Most men assume that if something isn't working in the bedroom, the problem must be blood flow. But what if the issue isn't plumbing, that it's actually the brain? That's what we're going to talk about today. PT-141, a sexual peptide that is definitely popular with my patients. Welcome back to the channel. It's Dr. Durst, and I specialize in peptides and sexual wellness. So today we're going to talk about PT-141. This is one of my favorite peptides. It goes by the generic name of bremelanotide. It is very different from drugs like Viagra and Cialis, or those PD-5 inhibitors, because those medications work on the vascular system. So they help to improve blood flow to the penis. That's great if the problem is a piping issue or mechanical, but PT-141 works in a completely different way. It works in the brain, and it works on something called melanocortin receptors, which are part of the neural system that's involved in the sexual desire, arousal, and response for men. So, in simple terms, this medication doesn't force an erection, it turns on the signals that lead to arousal and an erection. That's a huge distinction. So many men don't actually have a blood flow problem. They may have a low sex drive, low sex desire, difficulty mentally getting engaged in the moment, inconsistent responses, and that can play a huge role for men. So while I say that erectile problems or erectile dysfunction is not a psychological issue, that does play a role if men have experienced inconsistent erections or performance problems. And if performance feels unreliable, then it becomes a definite issue for men and their confidence in the bedroom. So this becomes more common if with aging, hormonal shifts, poor sleep, stress, even relationship issues. This is more common with age, and as erections get inconsistent, then you need something that builds that confidence. And that's where PT-141 comes into play. It works upstream in the brain. So instead of trying to mechanically enhance an erection, it can help stimulate the brain's pathways tied to that erection. So the signals are stronger and the body responds naturally. Men frequently describe effects such as an increased desire or sexual interest, an easier arousal, sometimes even a spontaneous erection, stronger responses once they are stimulated, and the number one key for a lot of my patients are improved confidence. When we do sexual wellness, what we're usually seeing is a man's coming to us because he's noticing some difference in his erection quality. And a lot of times that's been an inconsistent erection. It hasn't been consistent. They start to get in their head about that. And I think that while we're regenerating or while we're looking at hormones, that PT-141 allows us an option that can get them erections and get their confidence back. And it's acting on those neural pathways. So this peptide can also be important if a man doesn't have abnormal labs or isn't on testosterone or his testosterone is optimized. Then that can actually lead to the use of peptide. And in a third of our patients, hormones might not be the sole answer to some issues that they might be experiencing. So just know that PT-141, though, isn't an instant switch. It isn't an aphrodisiac, but neither are the PD-5 inhibitors or Cialis and Viagra. All of that is supporting your body's own mechanisms for stronger erections. It's either blood flow or it's the brain. It is agents that we can use to enhance your biology, but not override it. Timing matters. And this, I will say, is one of the most important things for my patients is that I think everyone loves men and women, but it depends on timing. It might be 30 minutes. It might be 5 hours. So you really have to play around with this peptide and see what works for you. It doesn't have to be taken on a daily basis. It can be taken prior to sex. But again, you want to know what timing works for you because it works in the central nervous system. Again, you don't want to just go ahead and do the online peptide ordering. You want to make sure that this peptide is right for you. You want to have medical screening and you want to have a physician prescribe it that is specializing in peptide use. You don't want to use it if you have cardiovascular disease, neurological conditions, or uncontrolled blood pressure. Side effects, again, we already talked that timing is one of those issues. Nausea is a big thing. You could have nausea and vomiting, so I never recommend that you start this peptide if you have something special planned because it could cause nausea initially. And most of those effects patients do acclimate to, but you never know how long it will take. So, this is one of those peptides that I think you will love, but it depends on when it works for you and when that nausea isn't a problem for you. It's still temporary, but it can happen. And flushing is another one of those things patients might experience. So, the times that I would recommend this use of peptide, and we do in our patients, is if you've had inconsistent erections and you want the confidence back, that's one time. But if your interest is lower than usual and you feel like things are just off, then this is another time when you would want to use this peptide because it works in the brain and neuro pathway. If you have any other questions, if you've had experience with PT-141, then just let me know. I want to start a conversation in the comments. And again, I'm willing to deep dive into any other peptides and anything wellness or sexual wellness. Let me know. And hopefully this helps you understand PT-141 a little better.